Back now to our coronavirus coverage, and joining us, California's acting public health officer, Dr. Erica Pan. Now, Dr. Pan, thank you for joining us. FDA panel, we know, approved the Pfizer vaccine yesterday. The FDA itself could approve it as soon as today. We've also learned if this happens, some hospitals could start receiving doses as early as Monday. So let me just ask you, in general, can people start signing up to receive this vaccine?
So as you just mentioned, the first priority group, as both developed by national guidelines and based on our drafting guidelines work group and our community advisory committee, are that the first priority groups are going to be healthcare workers as well as nursing home or skilled nursing facility residents and staff. So those are the individuals that will be the first able to get the vaccine as it starts to come this month.
So let's say somebody has a relative in a nursing home. How can they make sure that a relative gets a shot?
That's a great question. I think, there's a lot of different, so to describe some of the steps that are happening, once all of that happens and there's approval and then there's shipment from the manufacturer to different healthcare providers, then it is actually the healthcare providers, the different health systems are going to start providing vaccinations. So again, a lot of that is happening first with the healthcare workers, and then you may also know about some partnerships that the federal government has put together with certain pharmacies, and California may be activating that in the near future as well, that will be another way. I think it will probably be asking in the specific facilities if they have heard yet, and then I think as local health departments also know about their allocations, that is another way individuals can find out as which facilities will have the vaccine and how it will get rolled out.
Doctor, are there any estimates about how many people need to get vaccinated to make a difference in hospitalizations, maybe free up some of those ICU beds?
So those are sort of multi-layered questions and a great question. I think in general, right now, we need to focus our vaccine per se right now is for everyone to be wearing a mask, right? And especially in those of you in the regional stay-at-home order jurisdictions, to stay at home, as you can see from my Zoom background, really need to minimize any kind of mixing. When you do need to be out doing any essential activities, to wear a mask and be physically distanced. This is really what's most important right now to help protect our hospitals and our healthcare systems. I think over time, as far as how many people we need to get vaccinated, there are a lot of different estimates out there, but probably, for other, what we call community immunity or herd immunity, is typically over 80% or so of people. So we do have several months before we'll be able to get that much vaccine out to a broad number of people.
Let me ask you a quick question too. We know initially we're going to see a few 100,000 doses here, frontline workers, people most at risk. When could we see a significant amount of more vaccine dosages?
Sure. So again, I think that's, all of this evolves every day, but we can say that by the end of the year, so by the end of December, our understanding is we will get over 2 million doses between the Pfizer and the Moderna vaccine, assuming that the Moderna vaccine also gets approved by the EUA and recommended by our scientific safety work group. And but we do also know that between healthcare workers and skilled nursing home residents and staff, there are about almost 3 million. So it will take at least this first month to really cover all of our first phase 1A categories of, again, healthcare workers and skilled nursing facility or nursing home residents and staff.
All right, let me ask you one final question here. We've got about 30 seconds. The tier system that's been in place for several months now, and now suddenly we're back in, stay-at-home orders. Do you think that tier system ultimately failed?
Do I think the tier system, what was your end part of the question?
The tier system, we've seen for several months, purple to red
Yes.
and orange and moving back and forth. And now we see the entire state, except I think for 1 or 2 regions, still not under stay-at-home orders. Do you think the tier system ultimately failed?
No, actually, I think the tier system is what helped us, again, have a slow and stringent reopening, and what helped us, I think, as you all have seen across the nation, that the other parts of the country and other states have had much, much, much worse surges. They started much earlier, and I think a lot of them opened very quickly. And I do think that our slow and stringent approach actually helped us have the lull that we did. We had a plateau sort of right around the time that we started slowly reopening. And I think we really didn't start to see this surge start until November. So I do think that if we hadn't done that approach, that we would be in even worse shape right now. So I do, California has done really well as far as our death rate per capita, our hospitalizations per capita. And if everyone can come together now to stay at home and again, wear your mask, keep your distance, we can do it again. We have been, one of the least impacted states per capita compared to others, and we can do it again. And I do think our tiered approach was absolutely helpful. And I do think, after we get through this stay at home, we'll be able to come back to that and again, use that approach to gradually and slowly and in a stringent way, have a gradual reopening to try to keep this as carefully as possible, and we will start to be vaccinating people as you initially asked.
All right, Dr. Pon, thank you so much for your time, for your insight, and stay safe. Thank you.
Okay, thanks, you too. Bye-bye.
All right, and we'll be right back.